this is what must be done before they can even do anything. And to all of this, so many lives are lost on a daily basis.
Somebody was sharing his experience sometimes ago about what he encountered at one of the A&Es in one of the hospitals. When they rushed that victim to A&E, they didn't even allow the person to be brought in at all. They were saying it right there.
From the gates.
Please don't bring him in. We don't have facilities. That's another angle. That's another point of view that need to be discussed as much as possible, because most of these hospitals, they will tell you that they don't have enough bed spaces. Like the case of that man,
Yeah,
it's a trauma. It's a trauma for him. It's a lifetime trauma. So they will tell you that they don't have enough facilities. They don't have bed space. They don't have this. They don't have that. I think that rests on the part of the government as well to provide all of this. But if government is doing the needful, what happens to we as health personnel? What happens to us? Are we also doing the needful? Are we also doing what is expected of us from our own ends? So these are some of the things we're looking at this morning, and we're opening the lines now. 0803-437-9453. What's the way forward? Hello? 0815-032-0226. Those are the numbers to call. Let's what solution you like to provide to this issue on ground, and of course we'll chat a way forward on that. Hello.
Good morning.
Good morning, ma. Good morning, ma.
Thank you for joining us.
Okay. Amen. Thank you.
Thank you for your
This is
contribution.
Angela. That's another angle. She's talking from another angle. When you go to private hospitals and they tell you that they don't have enough personnel, that's another germane
Very
factor.
gentleman.
Hello.
Good morning.
Good morning.
Good morning. I like to meet you. Good night, man.
Thank you for joining us, sir.
I'm calling from Mirakari in Omo. We have been talking that we need to restructure all these sectors. The sector. I have been a victim of the both from that and the also called better medical. You see them, they will ask you to come inside, come and see whether the area is space. They will show you quite right. And you see them overworking because the majority of them are working. That is the point. We need more to declare state of emergency on the earth, to have more general hospitals. And people should understand one thing again, that prevention is better than cure. They should, Nigerians, all the accidents, all the social thing, we should try to avoid, follow the rules, and prevent. That is the solution now. Because let me tell you, for my doctor here, let me say we are going to die. How many kilometers? Because you can see the any general hospital. Joko die, but therefore you die. If there is no space, you go to Yaba. That is the worst situation where our health sector is now. Let them look up to have more general hospital. If you look at the example of giving from Shoyoye, you see the population there, down to the Jai, no general hospital. Where did anything happen? So we need to have more general hospitals so that people will take that to that. They won't depend on the Jai and federal medical. They are overwhelmed. All those places, they are overwhelmed. They are overwhelmed. We have a good personnel training. We have them. It's because we are overwhelmed. That is what's happening. And the issue of government policy, when you are going to go to hospital, you just have to buy a drug and something. Even most of the nurses at times, when you don't have, they use kindly. Even in the teaching too. I know of secondary school where the teachers are paying for when they are paying before this admission, when they are paying for the about 12, 13 students for the what's so called for their peoples, just to not allow them because they are better.
Okay.
That is the point. The nurses are doing the same thing. They need to the state of the general hospital. We have more general hospitals. That's the solution. Don't blame the personnel.
Thank you.
So the government will need to blame. Thank you.
Thank you.
Thank you for your contribution, Adebanjo.
Nígbà tí Popsi mi wà ní A&E backup, mi ò kàn fẹ́ sọ pé mi ni. Ẹnu gate tó bá ti fẹ́ wọ A&E báyìí ilẹ̀kùn yẹn máa ṣí fúnra rẹ̀. Mọ́tò yẹn dẹ̀ ń bọ́ tààbọ̀ kò tí ì mọ condition
The state level.
Oh, okay.
Now, doing something first. The doctor should do something first. Is from somebody who doesn't know much about the working of the hospital. For example, an accident happens and a patient with head injury or a ruptured vessel, femoral vessel. You rush to a general hospital. And you are telling the person to do the medical officer there to do something first. What will he do? Open the brain, repair a bleeding femoral vessel, transfuse with 20 pints of blood. Every should have a referral system. You understand?
Okay.
Taking a patient with pregnancy, ruptured uterus to a general hospital or to a community health center, what do you expect them to do? And another thing you forgot is that
Are you saying that at the community health center they don't have the wherewithal to?
they don't have the wherewithal, they can do nothing.
Oh, okay.
There should be an ambulance system, a referral system. The other thing you don't know that these hospitals, they are overwhelmed.
How?
The health workers are overwhelmed. Let me give you an example. A friend of mine came from the UK day before yesterday. And I was telling him that in the specialist clinic, I see up to 60 patients per day. 60. He only sees 5 or 6. And he would have been told beforehand the numbers and the conditions. Do you get what I'm saying?
Yes. Okay, that means lack of personnel.
Lack of personnel, one.
Okay.
Overwhelmed. People are leaving Nigeria every day. Do you understand? Then our patients are paying out of pocket. 14 years ago, as a young medical officer, I had the same passion as you have. Every time a patient comes, I will take money out of my salary. They will do the CS. Then we'll start tracing them. Then we'll go into the villages. We'll be looking for them. There was a patient I paid about, my salary was just above 100,000 then. I paid about 70 something thousand, the pregnant woman who had a twin and they had a CS done. By the time I got to the village, it was a mother house. How do I recoup my money from that kind of thing? And when I got married, I couldn't continue that.
Based on responsibilities.
Yeah, there is no policy on ground. Blaming a talker is blaming the wrong person. A patient with the one that happened in Lagos, preeclampsia, who was rushed to a private hospital, and the social media was agog, blaming them why would they deposit. How does the private hospital run his hospital? That patient will need an urgent CS, we need transfusion, we need antibiotics, and the fact that no money on him. If you do that for 10 patients, the hospital will run down. All your staff will lose money, and your life will be in penury.
Okay, now, doctor, I'm sorry we have to engage you because it's like this is what we
really
have
hitting the nail on the head.
Yes. So what about at least giving first aid treatment to such patients?
Now, first aid treatment is just grammatical. The patient with ruptured uterus, you set a line and you give fluid. The fluid is waiting into the abdomen. That patient needs an urgent surgery with about 10 bottles of blood prepared. Any private hospital that engages in that, and by the time you set the normal saline, and the patient becomes pale and die.
Okay, Dr. Olaoye. Hello, doctor.
Doctor, are you still there?
Hello.
I think it's the network. Maybe he can get back to us. We still have more questions for him because he really
it's really
opened
dwelling
our
more
eyes
on this discourse this
exactly. Hello.
Hello, good morning.
Good morning,
Thank
sir.
you for joining us, sir.
Can you please speak up? All right, Alaji Ajibode, we are hearing you.
Sometimes people took a from our for getting here for some Sunday. We met, I think we met for Sunday. When we got here, we met them watching video on their phone. We told them we brought an emergency, we came to us. That man is getting the best. You should take him to Adebanjo without touching the person. We left that state hospital on that day. When we got to that junction, garage junction, we decided to take the person to a clinic. When we got to that clinic, immediately we collected that person from us and attended to us within 1 to 1.5 hours. The mother of the case that stayed with the person came down home. Mama, what's the problem? He said that he wants to see him back home to prepare for. Now, the question I want to answer is that why is the nurses are so wicked than the doctor? We expected this to have all these things to have happened to doctor because the people say men they are not passionate, they are not like it is part among the business and not doctor. What's the problem?
All right, thank you, Alaji Fatai Ajibode from Ilaru. We've seen cases of doctors scolding nurses. Like Alaji Ajibode rightly pointed out that negligence on the part of the nurses. A patient is being rushed to the hospital, and of course, you can't save that patient's life. And then you were busy pressing your phones, you were busy gossiping, and saving lives. What happens? Sorry. Okay, we have Dr. Olaoye back on air.
Okay, thank you very much. Yeah, so as I was saying, you said, we want to render something that the owner was probably not supposed to. They said the line, they use some issues. You understand? And before you can say that, call ambulance before you see the patient in emergency. The ambulance have called the patient. The condition of the patient you are expecting. They found out that there is less sleep. You understand?
Yes.
So you are prepared. There is no issue of money because the NHIS, you know, the UK health insurance, there will be bill. Do you know what I'm saying?
Yes, sir.
Yes.
But only after
Now,
complicated is coming into an hospital.
Okay.
You understand?
yes,
And
very well.
there's no money. How many private hospitals can continue to do the pro bono service? Do you get what I'm saying?
Yes.
Yes, sir.
Especially when it comes to delivery. Once the patient delivers and your private hospital have invested a lot, and you give the patient and you go to the newspaper that you are delivering the patient, and the newspaper will get called. So we need a good government policy from point A to point B, what you know. How we deliver things. Many doctors have filled out of the bucket and they have factory. Do something. Do something. Remove your salary this month. Remove your salary next month. You have a wife. You have children. So what's the way forward?
Okay. Now.
Doing something. Okay, I'm listening here.
Okay. I'm sorry to cut you short. You know, based on what our last caller said, he talked about negligence of the nurses. That they had a case whereby they took a patient to a general hospital, and the nurses there were busy pressing their phones. They were just fiddling with their phones, not attending to the patient, and the patient had to be, rushed back to a private clinic whereby, the patient was swiftly attended to. What happens to, because we've seen cases whereby medical doctors called the nurses as well. When they gossip on duty, they press their phones on duty. These are some of the things. What do you have to say as regards this?
There's something that I'm an administrator of police many hospitals are on that. Now, when you are in UK at the emergency, in civilized world, even your phone should not be with you. Now, give it to you, should be kept. You professionally go and assess the patient and see if your facility can manage the patient. Do you understand?
Yes.
In many of the general and teaching hospitals, the authorities I'm talking about cannot happen because you are prepared to work in the teaching hospital. And there are administrators, there are different levels of it. So, punishment is very good, training is very good. What I'm saying is that, for example, where I work now, in the teaching hospital. Now,
Yes.
saying the patient is brought and the patient is not attended will be very long. Except there's no bench. But we take the decision from many of the general hospitals. Many of the general hospitals have nothing in them. Nothing in them. So even if bad patient nothing, by the time the nurses are there, many of them know that there's nothing that can be done for this patient here. They will verbally research. A lot of things are wrong about our health system. First is that in every of those hospitals, there should be equipment and facilities to manage different cases. And if you can't manage the case in your facility, proper referral system, an ambulance system, resuscitating the patient on the way to the next health care. Many of the private hospitals, once they have money, you want to go to the hospital, they can manage complex cases. How do they do that? There's a financier. Maybe they have money, they borrow money from the bank. And they have specialists they can call. So once you have your money at hand, they will admit you that responsibility. Call the specialist, train in that field, who will handle the case. And so many of us, so this general, if private hospital can manage the case and the general hospital cannot manage it, many of the general hospitals do not have specialists. Then the general hospital is different between those two and those two. You know that doctors are different from doctors. 14 years ago, I was a medical officer. Now I'm a neurologist. After 14 years of training. Meaning, anything that has to do with the brain, I can handle it. But another Nigerian is also a doctor. So the patient who fell from the bike, feeding into the brain, will be rush to the community health center or to the nearby general hospital where we have just one medical officer and one auxiliary doctor. And the other say, oh, the next generation, what will the medical officer do? How can I open the
Okay.
which area? This was considered the next I want to do.
Okay, doctor, please hold on. Doctor, please hold on. Hold on. All right, so Mrs. Adiaga, your question.
Hello, ma. Well done, ma.
Thank you for joining us, Mr.
appreciate
Adiaga.
this discussion, and this is a special one. I'm very I do appreciate the speakers, the previous speaker. My own contribution is please, still Ministry of Health has a special scheme. That is NHIS in the state, and it's functioning well. We have policy and principle attached to it, process and the system, and they're really working. My only suggestion to this special discussion is for each household across the state.
So, Mrs. Adiaga, are you saying that whenever there is accident situations, it covers NHIS covers it?
Yes, ma. We have to do something about it.
Okay.
Yes, ma. Because the scheme is working well. Even at the community level, we have PHCs.
Okay.
At the ward level, we have model PHC that got across with this principle of NHIS.
Okay, ma. Because of our time, let's allow Dr. Olayi to react to that. Thank you so much, Mrs. Adiaga.
Our NHIS system in Nigeria is a joke. You know, it's a joke. The amount dedicated for it is ridiculous. People with mental NHIS are looking at anti-malaria, contraceptives, and all. I'm talking about the comprehensive insurance, comprehensive monetization of insurance of an health system. If an Okada man have an accident in open field, captures the skull and brings the bleeding to the brain, he dies in their NHIS to not provide the bill. First, let me talk about what should be done. That patient should be rushed to a special facility when neurosurgeons should be waiting. How many neurosurgeons today have in open field? And they under the NHIS remuneration. While that patient is being operated in a neuro-care unit, the neuro-intensive care meaning an automated care system where there is nothing anesthetic, ready to receive him, 24 hours, you understand? If we ready to receive that patient, take over the respiration of the patient by intubation while waiting for the patient to wake up. All these processes have already cost millions. I'm not talking about I'm talking about the treatment of that Okada man who earns 2,500 or 3,000 per day. Does the Muslim system cover that? We are just joking.
Okay, now,
Doctor.
Yes.
Okay, thank you very much, Dr.
The last
Olayi.
question for you.
And because of our time, what about patients who have been referred from general hospitals to specialist hospital? Can there be a difference in the treatment setting? From who have been referred from general hospitals to specialist hospitals?
Okay.
Would there be a change in the treatment, or would there be a difference in the treatment setting?
Of course, there will be a difference in the treatment. For a patient to be referred to a specialist hospital or a teaching hospital means it's a complex case. For each level of care, there are treatments that they can undertake. You understand what I'm talking about?
Yes, sir.
The patient with intracranial hemorrhage cannot be managed in a general room. Because many of the general hospitals cannot afford to retain a neurosurgeon. So a neurosurgeon will be in the teaching hospital, waiting to receive the patient, open up the brain. After about 15 or 20 years of training, the senior doctor work on the patient. While in that same setting, there are anesthetists waiting to receive the patient because the patient cannot pass on in and breathe in on his own. You'll be intubated. So what people don't know, and the government is also not doing everything. The amount voted for health in this country is super ridiculous. It's very, very, very small that nothing can be done. The equipment needed are not present in any of the build the building, finish it, and say this are not to do. When the amount needed to equip is times 1,000 or 1 million, the amount you do to especially today have. Doctors are leaving Nigeria every day. This year alone, the doctors under me, 25 have left Nigeria. That's under me alone. What of other sectors?
Wow, that's
So
much.
our Nigerians are not looking at this thing. They are not moving as government responsible. They will be there. They are not doctors are not doing anything. They are focusing on the wrong set of people. They are focusing on being on me. They are supposed to see 10 patients per day, and I'm saying 60. And by the time I'm on 50 something, my emotions is high. I'm already angry.
Yes, you begin to transfer aggression. All right, Dr. Olaoye, because of our time.
Now the patient is not the one looking after the medical personnel.
Now, we want to thank you sincerely. I want to thank you for shedding light on what we don't really know. This is what you said. It's just an eye opener to so many things that we knowledge of. Thank you so much, Dr. Olaoye from Lagos, for being our resource. They have a wonderful day.
Okay, we'll take 3 more calls before we call it a wrap. This Thursday edition of Money Fight. Hello, good morning.
All right, good morning. In 60 seconds, please.
Good morning, Titi. Good morning, Emma.
Good morning, sir.
Thank you. Please, I want to beg that doctor. That's what I'm calling.
Okay, sir.
I'm calling to beg him because of an experience that I been having a number of years back now. Last, one of my former students left Nigeria. He is somebody who has been with me for work, and he is now a consultant. He left Nigeria for Canada, relocated totally with his family, and they have been reporting back to me that there may not be anything that will bring him back to Nigeria because even the nurses in the hospital where he works are very, very helpful. They simplified his job for him. Now, the doctor that was on this program this morning, my plea to him is that he should please not run away.
You should not jump out.
When you have people like that, just because they get frustrated, they run away.
Okay.
And I am happy at his comment on the NHIS.
Okay.
I have colleagues who have had very bad experience of the NHIS. Kind of to say, yes.
Okay.
So, and the doctor like that, like the Dr. Olaoye, right?
Yes, Dr. Olaoye. Yes, comrade, at this point, we just have to call it a wrap.
Okay, that's all right.
Yes, thank you, comrade Adebanjo. Well, we just hope that at the individual levels will do what is expected of us to save lives, especially the health partners. Thank you so much for your calls this morning. And of course, to all of you who, when we were not able to pick your calls, we're so sorry. We apologize for that. All right, the production crew.
Yeah, so the editors in the newsroom, Adebanjo Wahab and Bisola Oludotun. To our sound manager this morning, Yemi Seri Kudi, and also to the woman behind the ICT, who was making sure you're watching us live on our YouTube and Facebook page for Lake Soweto. This is a production of Yemi C. Shodepo. I am Emmanuel Adebanjo. Do enjoy the rest of your day.
My name is Titilope Awobajo. Stay tuned for editorial review.